Hello, Saurabh sir, can you hear us? Can you hear me?
Has it joined actually? Joined without video that at least window appears. Have you seen him on the chats?
Saurabh sir, can you just turn on your mic and camera so I can check for the final 1 minute?
I thought my mic is already on.
Okay, sir. So can you just put on your camera?
Yeah, I'm trying. There is
Yeah.
some-
After
I'll just try.
after next to that mic symbol, there's a camera symbol. And sir and ma'am, after we go live, please stop talking among yourself because everybody can hear you after we are live. Okay. And after we go live, I'm gonna play a 30-second video, and then you can start the session.
Oh, good.
Saurabh sir, please turn on the camera. I won't be able to connect with you in 20 seconds.
Good morning. Namaskar. My name is Raghuram. Welcome to this webinar on COVID-19 silver lining, emerging opportunities for health tech entrepreneurship. It's indeed my privilege and honor to be part of this webinar, moderating this session with some of the I don't say luminaries, but the people who actually have made an impact in the lives of people in the healthcare industry. I've been following each of the panelists, and it's really wonderful to have them on a very, very contentious and apt subject for today. So what I do is, before I introduce myself, I would like to request each one of the panelists to say a few words about themselves, who they are, where they're from, and also what exactly in the healthcare delivery they're playing a role. Then we'll get back and then start our the topic. So may I ask Dr. Karen to go ahead, please?
Yeah, sure. Thanks so much, Raghuram. Thanks a lot. So hi, everybody. My name is Karen. I'm based in Singapore, but an Indian at heart. Totally love going back to India. Unfortunately, because of the COVID, haven't been able to visit India. So I'm the regional business lead for worldwide healthcare at Microsoft. What that means is that Microsoft has about 8 to 9 industry verticals. Healthcare is one of them, and I lead that for the JPAC region. And at Microsoft, the role that we play is, I'd like to kind of share with you our mission statement, and that's basically to empower every person and every organization on planet Earth to achieve more. And because of that, we kind of recently launched the Microsoft Cloud for Healthcare, and we've been doing a lot of pioneering work in the area of healthcare. Happy to share more as we go along. Over to you, Raghuram.
Prashant, would you like to go next?
Sure. My name is Prashant Warrior. I'm the co-founder and CEO of Cure.ai. I live in Mumbai. My background is that of a data scientist. I've been doing data science in AI for the last 20 years. Done data science in various fields. Started with retail, consumer products, logistics, fashion, advertising, and then set up Cure.ai in the space of healthcare about 4 years ago. Our focus is the use of AI to interpret radiology images. So we interpret X-rays, CT scans, and other radiology scans using AI. And today we are in about 28 countries deploying these algorithms. Thank you for inviting me to the session and look forward to participating.
Thank you, Prashant. I've been following your organization. I think NASCOM has been working closely with QDET AI, and it's an impressive growth story of your startup. I don't call it startup anymore, but your enterprise, and wish you good luck. Nice to have you on board. Mr. Raj, may I request you to go through the introduction of yourself, please?
Sure. Thank you, Ram. And thank you for having me on this panel. My name is Siraj Dhanani, and I'm based in Bangalore. My background has been in the healthcare field for all my career, initially in the pharmaceutical domain, uh, then in business analytics for healthcare, which is my first and previous startup based in Bangalore. And now my venture in Axel, we are working in the space of medical technology. So what an Axel does really is identifies critical unmet needs that are seen in the Indian healthcare system through very close engagement with doctors and hospitals in the Bangalore area. And over a 6 to 9 month period, identifies and sort of specifies a problem to solve. And then we develop novel technologies to address these problems. So today we have a portfolio of products in the critical care and the maternal care space, which we had just launched in late 2019, and the COVID scenario just kind of put a lot of that to stop. But during the lockdown, we also developed a product for the COVID space, which I'd love to talk more about later. Uh, so broadly, I think an Axel is trying to solve problems that we perennially see in the Indian and emerging market healthcare space, and we are hoping our products really make a difference in healthcare delivery in India. Thank you, Raghav.
Thank you, Siraj. Saurabh, nice to again get back and talking to you. Nice to see you again, and welcome to this panel. And may I request you
Same
to
here.
go through your introduction before we launch into our most important topic of the day.
Sure. Well, hi, I'm Saurabh. I represent Meadow. We started about 2 years back. We're actually in the space of organizing the entire outpatient care, which we believe that is actually the most important step when it comes to your care journey. Because I think in India we lose 2 million people every year because of not being able to provide them timely quality care. And I think the bulk of that comes from our mindset of being able to delay care, essentially because this entire outpatient care is so unstructured, it's so distributed that it's not coming together. And I think that's the little work that we're trying to do. We are actually physical, digital, whatever word you want to use, outpatient care chain. So we have about 300 odd clinics in NCR, and we have our online platforms where you can get care or one-stop care, whether it's in terms of doctor consultations, tests, medicines, lifestyle, nutrition, products, devices, medical equipment, home care, everything under one roof. So that's essentially what we're trying to do, and using technology as the backbone to kind of fill the gap that so widely exists today. Right. So that's quick introduction about Meadow and me.
Thank you, Saurabh. And myself, Raghuram, I work for National Center of Excellence for IoT and Artificial Intelligence. I lead the life sciences healthcare vertical there. As we all know, NASCOM is one of the largest technology association, leading the 180 billion right now to 250 billion by 2022. And by virtue of which association with large tech companies bring out the healthcare and life sciences related solutions. And we also have the mandate to run the health tech innovation in the country. So, with the help of the entire ecosystem consisting of the tech enterprises and health tech startups and SMEs, and we integrated them with the entire ecosystem consisting of pharma companies, medtech associations, medtech companies, and healthcare insurance organizations, and academicians and government. So we work with three primary focus areas. One is to promote the entrepreneurship of the health tech enterprises in the country. Number two, provide a digital transformation assistance and catalyzing power to the enterprises to pursue their digital transformation. The third most important is how we can actually play a role in bringing technology into the people's lives, working closely with NGOs and especially the government organizations. That's where is our focus is about. So that's about myself. Thank you very much, the panelists, for joining the session. So let's quickly get into the topic of the day. I would like to start with two profound statements, which I would like to. This is related to COVID-19. So the two prominent doctors who have been in our forum in the past, one of them, Dr. Devi Shetty, about 4 5 months back, was talking in one of the forums, said the health tech entrepreneurship is not about meeting the current need of COVID-19. If any one of you started jumping into the health tech entrepreneurship, don't do it. So you take that as a stepping stone, a learning opportunity, and go beyond. It has given you an opportunity to repurpose your innovation. So that is one point I would like to say. Second point I would also like to say about is COVID-19 is why people are more focusing on COVID-19, why not people looking at the people who are dying in the accidents, people who are dying of the cardiovascular diseases, cancer. Uh, why is it so? I don't know. People have actually been criticizing the government about not focusing on other things and putting a lot of money in COVID. The only thing which answer comes to my mind, probably you can also give your perspective, is COVID is so fast. It is too quick to kill a human being compared to a cardiovascular disease or a cancer. So its uncertainty of the life of an individual cannot be predicted. So that exactly is the reason why people are worried about COVID. Now, having said these two profound statements, I would like to set these. Can you hear my voice properly,
Yeah.
panelists? Okay. So having said that, the health tech entrepreneurship has actually transformed who is a health tech entrepreneur. For example, in the recent past, we have seen a lot of people's the mechanical 3D printer, 3D printing organizations, startups have suddenly become health tech entrepreneurs by coming out with a ventilator, the splitter for the ventilator. And a person who is actually trying to do a mechanical manufacturing started manufacturing the ventilators. So the repurposed startup, health tech startup entrepreneurs have resurfaced, and many of them have quickly jumped and really helped the people with whatever innovations they have and repurpose their innovations. I think that is the kind of the greatest opportunity. I would like to lead into the discussion by putting a few specific topics which could be of interest for our the listeners. The first thing I want to ask, see, what exactly, each one of you can answer for this question. What, in your opinion, is the significant impact COVID pandemic has on healthcare in India? It's not about technology. I would like you to specifically address how the healthcare delivery in India has been transformed. Maybe, Dr. Karen, would you like to go up with, maybe you can bring in some international perspectives as well.
Yeah, sure. Sorry, can you hear me?
Yeah.
Yeah, I think my video is kind of frozen, but yeah. So I think from a not just from India perspective, but from an international perspective, one of the things that we joke about in Microsoft in the healthcare realm is that what we were trying to achieve in the last 2 years, we could achieve in 2 months. So we've been trying to convince healthcare organizations that they need to kind of digitalize, they need to kind of integrate data, be able to make sense of the data that they're collecting. And I think it always fell on probably very reluctant ears. But come COVID, we see suddenly people coming to us and saying, tell us, how do we kind of live in this kind of a new world? So I think one of the biggest impacts that we have seen is that during COVID time, of course, a lot of organizations moved to the digital world, especially in the private healthcare. But I think going forward, Raghuram, I think we will be living in a hybrid world where some would be live and some would be virtual. Now, having said that, I think given this 5 to 6 months that we've gone through COVID, there are a few technologies that have definitely come to the forefront. One is we've gotten a lot of, as you correctly mentioned, supply chain. How do I kind of digitalize supply chain? Because that was the one which was most broken. The second one is what I would say as virtual healthcare, and that involves a lot of things. It involves telehealth, it involves remote monitoring, continuous monitoring. So that was the second one. The third thing that came up was patient 360. Because you see a lot of hospitals, even in India, when I used to talk to them, you had patient coming to hospital X, and they have a subsidiary, let's say in Chennai. So you have the main hospital, let's say in Delhi, and they have a subsidiary in Chennai. And this patient who was earlier going to Delhi suddenly kind of appears in the Chennai hospital. They don't have the electronic medical record of that patient. So they're not able to see what the past history is. So suddenly hospitals realize that, hey, we really need to kind of coordinate systems across the region to be able to have that full 360-degree view of the patient. So these are some of the, I would say, the areas where we've really seen an acceleration post-COVID. And having said that, and given this topic that we have today, I do see that tech entrepreneurs have a big role to play, because no player on earth can ever give you the full solution to any healthcare problem. So I think this is where health tech startups kind of play an important role in plugging those gaps and being able to offer that full continuum. And just to share with you that Microsoft, you'll be surprised to hear, that works with almost 68,000 partners at the minimum in the global level on their healthcare and other areas as well. So this is really an ecosystem play where everybody comes together with solutions to kind of help solve that problem. And I think that has been accelerated tremendously during COVID time. Over to you, Raghuram. Sorry.
Raghu, are you there?
Yeah, we can't hear you. I think your video is probably frozen.
I think I'll just move on. I'll just answer this question as well till he comes back, right? In my personal experience, I mean, I will start with a controversial statement. I mean, I think this COVID pandemic is like demonetization for health tech. And what demonetization did for Paytm and all the payment gateways or mobile wallets, this is COVID-19 is doing that for health tech companies. So I think that is a change that we are seeing. I'll talk about the basic need, right? As a patient, I mean, my dad is 70, he lives with me, and when he fell ill, I don't want to take him to a hospital. I want to be able to take care of him at home, right? So home care services, teleconsultation, all of those become very important. And so you want to be at home during this pandemic, and you don't want to go to the hospital where there is a risk. So a lot of need has come up where you want to provide that care at home. So all of these kinds of services, telemedicine services, home telemedicine, remote care, many of these services have become much more popular during the COVID-19 pandemic. And this is also something which is going to last, right? Think about it this way, that if I have to go to the hospital, I have to drive half an hour each way. I have to spend 1 hour on the road. I have to take an appointment beforehand. Even with the appointment, I have to spend probably 1 hour waiting for the doctor. So in all, I mean, a doctor's appointment is like 2-3 hours of my day. And if I'm doing that online, I'm saving probably, 2 hours and 50 minutes. I mean, it's like a 10-minute, at max a 10-minute out of my day that goes in for that appointment. So I think teleconsultation is going to be the future of medicine. And it is something which has been expedited due to the COVID-19 pandemic. And of course, that is on the telemedicine side. What we're also seeing is that from Cure, where we are providing AI interpretation for X-rays, CT scans. You're seeing a huge amount of adoption in the rural parts of the country where they don't have radiologists to read these X-rays or CT scans. And I'll talk about that more later. But I think in general, I mean, at least personally from my experience, what I've seen is that the number of people that were using Cure before COVID over our last 3 years of history has more than doubled in the last 6 months. And that is the kind of adoption that we have seen. And I will hand it over to you, Siraj, to talk about your experience with COVID-19.
Sure, thank you. No, I agree with you, Prashant. The sort of phenomena of going to the hospital or going for physical consults, especially for routine things, is getting increasingly questioned. And we are seeing this in the maternal care space, where we have a product which is intended for pregnancy and labor monitoring. So mothers in their last stage of pregnancy after their full term need to go to the doctor pretty much every other day to check on the health of the fetus. And that today is, as you can imagine, a high risk sort of encounter given the spread of COVID. So there is a lot of interest and a lot of push for moving some of these things to remote, to maybe home monitoring, where the mother can monitor herself and the data can be shared with the doctor for real-time decision. And I think we will see some more of this. I think up till now, remote access, remote monitoring was nice to have. People were sort of weighing the benefits and the convenience versus, the security of having a physical person there telling you. That now has changed, cautious of going into high-risk environments like hospitals. And I think that will really spur an increase in the remote monitoring and digitization of healthcare.
Over to you,
Over to
Saurabh.
you, Raghu.
Sure, thanks. So I actually completely agree with the thoughts that have been given so far. In fact, Prashant, you kind of stole my move there, because I actually define it the entire last 6 months as the demonetization event for healthcare. But there's a couple of things that that it comes with. If you look at how the entire thing panned out, there was a huge surge, and then there was a clawback in a way. And what at least we being omni-channel are noticing is that while we had the surge towards digital, there has been a clawback. But where it's going to settle is at least 20% above where we were, pre-COVID levels in terms of technology adoption and the preferred channels. But more importantly, I think what is definitely happened is it has opened technology up to the healthcare professionals, which somehow just wasn't getting through. And I think that's the biggest change that is, I think, going to sustain itself. I think when it comes to teleconsultations, despite the concept being almost 1 to 2 decades old, we have still not, I would say, mastered the best way to be able to provide it. And my view on why that is happening is because there was no acceptance, whether on the patient side or on the doctor side, that technology and the methodology just couldn't leapfrog. What we have right now with us is, I think, the opportunity to be able to leapfrog the communication, to be able to leapfrog the way we are going to make these teleconsultations and e-consultations happen, because clearly the intent is there. But I think we're still all doing doing the catch up to ensure that the change that we are going through is sustained through better technology, better care, honestly, because today I think there is a lot of checks and balances missing when it comes to e-consultations and overall technology. And I think everybody together is working hard to bring in those checks and balances, to bring in those quality assurance parameters, so that we can make it a better experience for everybody involved. So with that caveat, fully agree that I think it's a good, I would say, situation for us to be able to understand what all is still lacking from the system, right? Sometimes we need a rude shock for us to kind of wake up to how poorly we are conducting ourselves when it comes to healthcare. So
Yeah,
I'm hoping
thank
that
you.
this
Can you
learning
hear
kind of
me? Can you guys hear
stays
me?
much beyond. Yeah.
Yes,
Yes,
yes, you can.
Perfect. Just I
welcome
think
back.
you. I've been listening to all the conversations. It's been very interesting for you, for me to hear. The way world has transformed in the last few. Sorry, I was not able to show my face. I have to shift the to a little bit better place. That's what is happening. There's a lot of transformation happening as we are shifting sheets in the new normal. Um, One more important point I want to raise at this point, especially from health tech entrepreneurship perspective. We have seen a surge of a rejuvenated entrepreneurial spirit coming from a lot many people. They repurposed themselves. At the same time, uh, it is not able to infuse themselves into the mainstream delivery models. I have witnessed, and there are a few organizations coming forward and trying to look at a kind of a mergers, not necessarily from the acquisition point of view, trying to integrate their solutions for a more integrated approach to providing an orchestrated solution to the patient, or help the HCP, rather than trying to exist on their own. It's becoming very difficult for them. You as such, the adoption level of technology into healthcare, it always comes with a little bit of a skepticism, right? About, is it the right solution? Is it the right price? Can you do it? Is it validated? On top of it, now, especially in the COVID has given a little bit of a faster access to technology adoption. That's definitely for sure. But still, there are certain challenges available. I would like to hear from you how you see the collaboration between multiple sets of health tech entrepreneurs. Has it really improved, really, as people see? Or is there any downside which is felt by some of the health tech entrepreneurs? Do you have any perspective from that side? Any one of you, probably, if you
Sure.
want
Let
to
me take this.
look at,
Yeah.
I may ask Prashant and Saurabh to address this particular question, because you have been in a
Sure.
context where delivery less innovation, both are there.
So I can go first. I think I mean, as I mentioned earlier, health tech adoption has been extremely rapid in the last 6 months. I mean, what we have seen is really rural sites in Assam, Maharashtra, Madhya Pradesh, Chhattisgarh. They have adopted AI. They have, because they don't have people, they don't have radiologists to read X-rays. They have started using AI, because AI is assisting a physician when there's a doctor in interpreting the X-rays. So that is something that has come about. I think that what has also come about is a change in the government's perception of these technologies. So one of the first places that we deployed when COVID-19 started was the Bombay Municipal Corporation. And they were very eager to adopt AI. They worked with us very closely over the first 4 or 5 months in making AI part of their workflow, right? And I think so governments have seen that change. Definitely, I mean, the Indian government, Niti Aayog, they are working through this whole health tech platform. Something called Swasthya has come about, which is the telemedicine platform, right? So there is a lot of focus from the government on enabling health tech to scale up within the country. And also there is a need. I mean, I think the need is also been there. A lot of government entities have started using healthcare technologies. A lot of the rural entities have started using healthcare technologies. And this is something which I've seen is very unique, right? I mean, if you think about it, when the kind of solutions that we build, which is AI for radiology, you would assume that the countries like US, UK would be the early adopters for that solution. But what we are seeing is actually the need is so much higher in the rural parts of the country, and they are adopting AI. In fact, today a rural hospital in Assam is way ahead of the best healthcare institution in the US in terms of adopting AI, because the need is so much higher there. It's like the cell phone technologies or financial technologies. I mean, fintech solutions like Paytm and so on. I think fintech in India is better than the fintech in US right now. And similarly, I think health tech in India can be better than health tech in US in the current era, because the need is so much higher. The need is so much higher. Of course, there are downsides to healthcare, because you cannot, I mean, unlike a fintech solution or unlike a e-commerce solution, you cannot just build something and put it out in the market. You have to validate it with multiple hospitals. You have to have validations. You have to have regulations. I mean, it has to be cleared by regulatory bodies. So for us, I mean, we have had to get it cleared by C certified, make it C certified product. We have to have had it cleared by FDA. So we've got FDA clearance. So I think all those regulatory clearances are important, and both outside of India and within India. And you have to make sure that that product works as advertised, because if there is something that is missing, it could lead to a loss of life for a patient who is not cared for in the appropriate manner. So that is something you have to be very careful about. And I think that is there throughout, not only in the times of COVID, and something to think about as you are, especially for health tech entrepreneurs as they are building new healthcare solutions.
Thanks, Prashant. Prashant, thank you so much. Now, Saurabh, before you start, I'd like to see, I actually want to look at working with multiple sets of entrepreneurship, health tech entrepreneurship coming together to create a kind of a seamless delivery. And some seems to be doing extremely well. Some seem to be actually struggling to really, have their footprint into the healthcare delivery. And you being on a kind of a healthcare delivery provider, but integrating a lot of technologies, how you have seen this perspective of the entrepreneur struggling and also having a greater opportunity?
Yeah, I think, by the way, the collaboration over the last 6 months has been, for me personally, the highlight of how everybody is coming together, right? So, and I think if we look very closely at the problem that each of us is trying to solve in healthcare, I don't think any one person can do it alone, right? So I think collaboration is inevitable, but I think there is also huge, and I can say this today because I'm working with multiple companies together, whether it's through through SWAST, whether there was some collaboration that we did through NASCOM as well. We're all realizing how it's actually 1 + 1 = 5, right? Not 2, not 3, not 4. And I think that realization is seeping in deep and fast. I am seeing far more openness, because see, initially whenever we used to try and collaborate with each other, we were throwing around things like trade secrets and blah and blah, right? So I think what has changed significantly over the last 6-8 months is the fact that everybody realizes that we need to lean on to each other to be able to make sure that at the end of the day, the person who's most important in all of this, which is the patient, is actually being cared for in the right manner. So I think I have seen a huge shift, and I'm actually very excited by it. And I think together, there is a lot more that we can do than what we can do individually.
Thank you. Thank you so much. It's wonderful. Now, there's one more thing about the way the healthcare delivery models are transforming. Especially recently, we had a conversation around the introduction of telehealth very, very extensively by government as well as the private entrepreneurs. Saurabh, you are aware of that, your platform along with SWAST. But also something about the integration of the delivery model. I'm leaving about the secondary and tertiary healthcare delivery channels. But what kind of new models are emerging? There is one which we actually are discussing with some an international group about. Is it a telemedicine based or a telehealth based channel which actually has to emerge? Or is it a general physician based view should be adopted for us to bring in more a better health and preventive health into the market? So there, you must be experiencing a few new delivery models emerging, how to deliver healthcare to the people.
Yeah.
Maybe I'll ask Dr. Karen. You have been in the international arena and Microsoft doing a lot of work internationally. Do you have any perspective? And Siraj, maybe you also bring in a different perspective from the medical devices delivery or supply to multiple organizations. Can you please comment on the emerging healthcare delivery models in India?
Yeah, so thanks, Raghuram. So I see four different type of models that are emerging, and fully agree with what Saurabh shared earlier. I think the basic tenet being that the definition of healthcare is changing. Earlier, if you were to look at healthcare, it would mean just your hospitals, clinics, doctors. But I think in the last, not just because of COVID, but even in the last 2 to 3 years, it has kind of broadened. So both in India and internationally, you do see payers, that is insurance companies, playing a big role in wellness. You see retail industry coming in. You see things like logistics, for example, Grab, and I'll share a few examples coming in into healthcare, basically to plug in those gaps which we ourselves have not in healthcare been able to fix. So these four models that I've seen emerging, and they have definitely been accelerated because of the COVID scenario. The first one, as I mentioned, is what I call as the out of hospital delivery model. Hospital is no longer going to be your point of care. It's going to be your community-based care. So we do see a lot of shift of care from hospitals to homes and to your, let's say, your clinic next door or somewhere near your house. And that is where things like telemedicine, remote care, continuous monitoring, all are coming in because you really, I think, like one of the panelists shared, you really don't have to go all the way to a hospital, except if, let's say, it's for a very specialist treatment or if it's for something that really only a hospital can do. You can get all that care in the comfort of your home and in the comfort of your clinic, which is next door. Now, this helps two things. One, it helps better care at the right moment. You don't waste time. Secondly, it also helps in transfer of skills right from, let's say, urban to rural area using technology so that doctors, let's say, in the rural areas are also skilled and equipped enough. And in case they do have problems, they can use telemedicine, doctor to doctor connect. I'm not sure if you've heard of Project Echo, but that's where you kind of have skilling of urban doctors to rural doctors so that care is given instantly. You don't have to wait, you don't have to travel. That's one. The second model that I see a lot coming up is what I call as patient 360, and what in a way it's patient engagement. Earlier hospitals were like this: you come to me, get yourself treated, go back. I mean, it's more demand than supply. But COVID changed it because private healthcare, many of them had, I think, occupancy rate of something like 20%, whereas in India, and I'm talking about less than 25%, when normally they would have 68%, right? Now hospital realize, hey, I have two big issues. One is I need to have patient stickiness. I need to have the patient always coming back to me. I don't want him disappearing during COVID or non-COVID times to some other place that is nearby, right? And secondly, once the patient goes back home, I still need to engage with him. Gone were the days when hospitals would say, okay, done, my job is done, no more. Now the patient is king, right? He's going to decide, where am I going to go, which hospital should I go to. So now hospitals realize, hey,
Absolutely.
host,
Yeah. Fantastic.
yeah, I need to engage with those customers. So that's what I call it a patient 360, because now hospitals realize with all that data, I need to know exactly the whole history of Karen, right from her birth to her end. I need to have that entire story so that I can engage with her in a very compulsive way. So that's number two. The third thing, and I think I want to share this with the panelists as well. This is something that you will see probably and to tell you, it's already happening in India. We call it the ecosystem model. Now, let me give you a hypothesis or like a made up story. Let me give you a real story. Okay, so we have this hospital in Thailand, and I see this happening in India, and that's why I'm sharing that. I work very closely with the hospitals in India. So we have this amazing hospital, which is really very famous in Thailand, coming out and saying, hey, I need to look after the pre and the post. So they came out with this very amazing health plaza. Now, how do I get patients to Health Plaza? So they sign up an agreement with Grab saying, you bring my patients on a regular basis every 3 months and take them back, especially those who cannot kind of move and who have mobility issues. So we prefix appointments, right? So you have Grab coming in. Then you have their Health Plaza that they're building up, and you say, hey, Health Plaza, great, but I need to have a digital store. So let me get in all the tech companies, the e-commerce companies from retail. Let me get them in. So finally, end result, the whole ecosystem was having a hospital, having a logistic company, having a retail store, which is acting like a health plaza, and a few others. And this begins to grow because you begin to kind of leverage on the strengths of each other. And then you look out and say, now comes 5G. Let me get telco in. And so even in India, you will see the discussion where telco is getting it. And interestingly, like in Japan, you may even have transportation companies coming in, like Japan Railways and Japan Post, for example. They are also looking at it and saying, I have a lot of data. How can I add to that whole ecosystem and make healthcare delivery really great? So, in short, Raghuram, what I'm saying is that the patient is becoming king. People are coming to the patient and building an ecosystem around the patient, and saying, hey, Karen, you have a work life, you have a health life, you have a family life, you have a social life. How can I put all the information of this around in a platform, in a data platform, and be able to engage with Karen in a very personalized fashion? So I think these are exciting times. The whole definition of healthcare is really changing.
Thank you, Dr. Karen. You thrown open. It conforms to some of our new models. What we have been witnessing. I'll request Siraj to give his perspective on the same topic for a couple of minutes. But at this point in time, I would like to inform the participants. We will open the Q&A. To post those Q&A, the moderator will bring us those some of them, and we will try to address some of these questions. We have 10 more minutes to go. In the next 5 minutes, after Siraj gives his 1 minute comment on it, I would like to bring each one of you to give a perspective about how the health tech entrepreneurship uh, can be improvised. What is your message to the health tech entrepreneurs with respect to what they can do with reference to the technology, what they are working on, and also how they can any perspective what you can bring in, especially from how to fit into the whole overall healthcare ecosystem. Siraj, can you just start with ending the last point about the healthcare providers, the delivery models emerging, what Dr. Karen has ended?
Yeah, sure. I think Dr. Karen laid it out beautifully in terms of the evolving models. I'd like to share a slightly different perspective though, and that could be a function of the environment where we operate in, which is typically the sort of mid and so I won't say low, but less resource uh, available environments. And while I think a lot of what we are discussing applies very strongly to diagnosis and monitoring, at the end of the day, healthcare and especially interventional care has to be provided on the spot. And that is where I think we really cannot dance around the issue of having healthcare facilities with the right infrastructure, the right staff, and all of that. While some healthcare delivery can also move out of the hospital into the home setting, like Portia and the likes are doing, I think at a very fundamental level in India, we have a situation of skill gap. There aren't enough trained and qualified resources to deliver healthcare even in our centralized hospital-driven fashion. And while I think skills can be transferred and Dr. A can be remotely managed by Dr. B, usually if Dr. B is so good that he can remotely manage Dr. A, he probably is working 16 hours a day. So I think there is an inherent kind of gap, especially when it comes to delivering care, and that is what really concerns me. And especially with COVID, the one negative we've seen is that healthcare professionals. I mean, I respect them; they are warriors dealing with circumstances that would shock most of us. Uh, they are kind of stepping back. There is a risk of infection. There is a risk of burden. Rightly or wrongly, there is a feeling that they haven't been adequately protected. And I just worry that maybe the delivery of care uh, takes a negative hit after we are done with the COVID surgery because doctors are fatigued. I mean, I've been in hospitals and with 3 layers of PPEs working 12 hours a day. I mean, it is bad. So, I mean, I think while there is a lot of positives that are coming out of this, I think there are a lot of concerns as well. And I thought it'd just be good to highlight.
If I think this is it's a kind of a reality as we are coming close to the session. Before I give my 2 cents on the approaches, what I suggest, and I request each one of you do it. I was speaking to the president of one of the largest association for hospitals in India. He said, if you look at the percentage of people who died of COVID, surprisingly, the doctors and paramedical staff percentage is significantly higher in this particular epidemic compared to the normal public.
Yeah,
And these people are really putting their best efforts out and selflessly serving the nation. Kudos to them, and
yeah,
we
yeah,
really
no,
appreciate
absolutely.
that. So, yeah,
Sure.
so that's a very important point. Just building on that, the two things which I would like to convey from a kind of the last messages is uh, one is any innovation or any technology, they should be able to be invisible rather than try to be visible, branded. I think the more and more they're invisible, make the HCPs prominent, patient and the doctor are the two primary things rather than they're fiddling with each, the technologies in, against each other. That really actually, puts off the entire delivery model because the average time, we have done an analysis of the average time a doctor-patient interaction happens
Speak
either
up, kar sakte hain?
that either on the telemedicine platform or on face to face is ranging between sometimes 15 seconds to about 1.5 minutes. That's average time people do it. In some instances, we have a few organizations, they more go between 3 to 5 minutes, but they're very, very limited, maybe 10% of the HCPs. So the invisibility of your innovation is paramount to ensure that this interaction is effective. The second point, which I would like to see, is something which we deal with almost like tens and twenties of innovations coming to us and trying to seek or support at NASCOM. What we have seen is their ability to collaborate. I think the moment you stop and say my best solution is the best, and this is I have platform, I have telemedicine platform, I can have doctor this thing, I have an interpretation platform. I think you are working in a small silos, and the delivery organizations do not have wherewithal to handle some 20 such innovations coming and landing at their doorstep. I think the innovator should start looking at the health tech entrepreneur should start looking at collaboration, sometimes drop a few functionalities and adopt somebody else's so that together they become a kind of like what Saurabh said, 1 plus 1 is 5, not just two. Okay, I think that approach is something which I would like to suggest. And then I would like to kind of a quick round robin from each one of you. If you can give two advices which you would like people to take it from here from health tech entrepreneurship. Maybe I'll start with Prashant. Quick 2 points, please.
Two things. I will say, if you are building technology, think global, because technology, if you build in India, can be applied to any country. So think global for the technology. Second is that patient safety is very important. I think building technology is easy. Making sure that you are taking care of patient safety and taking care of all the regulations that are there in healthcare, that is important. So think global
Good.
and focus
Thank
on
you.
patient safety.
Thank you. The quick, really good, Prashant. Thank you so much for being quick. We have to end the session in 3 minutes. So, Dr. Karen, what's your two cents for the advice?
So for me the first one is don't be a me too. What that means is that if there's already a solution that people have built, don't go the same way. Healthcare has so many areas where there are still no solutions. Look carefully, you will definitely see a niche, and as what you said, Raghuram, collaborate. Your solution can beautifully fit into somebody else's solution, and you can go big. You can ride on them, like be like that mollusk on the whale. You ride on it.
Thank you. Thank you. Siraj?
Yeah, well, I mean, I think for the few healthcare entrepreneurs who are out building, physical systems, electromechanical solutions, let's say, for the medtech space, it's going to take time. Just recognize that it's 4 or 5 years of engineering, regulatory, all of that before you get a product out that is completely safe, to Prashant's point, and reliable. Budget for that right up front. And the other thing I would say is the whole self-reliant India and the decoupling from China may offer interesting opportunities for domestic players to create products of not even equal but better quality and reduce our reliance. And I think that's the space people should look at closely.
Thank you. Fantastic. I think each one of you bringing it. And finally, Saurabh. So what's your tips?
Well, I think the first thing I would say is be bold, right? I think especially when it comes to healthcare, uh, everybody around us pushes us to be conservative, pushes us to be incremental. I think it's very important where we are to be able to think out of the box, to be able to experiment, and to be able to be audacious and bold with our dreams and our and where we want to be. So I think first thing I would push people who want to start up is to actually be bold about their vision, be bold about what they want to achieve, because it's a huge, huge, huge problem that we still haven't clearly solved. And second, I would say is, while you go about it, don't try and create everything ground up. I think it's very important to lean on. I can bring it back to the same collaboration theme, but it's very important to know what is out there and how you can use what is existing to kind of,
Wonderful.
I would say, quadruple the effect of what you want to build. So
Thank
just
you.
use
Thank
what is
you.
there.
I got the message. Thank you
Yeah.
so much. As we are in a hurry to end the session now. Thank you so much. Wonderful. I think the last 3-4 minutes is something which, in essence, which I would like to go through the video and then get the best of these messages for myself to follow and then work on it. Wonderful having you here, the panelist, and wish you a great day. Thank you so much, and we look forward to meeting you again. Thank
Thank
you
you
very
so
much
Thank
much.
you.
for joining
Thank
us.
Thank you.
you.
Thank
Stay safe,
Thank you.
everybody.